Hi everyone, this is Dr. Chhoda with Ignition Time and welcome to my channel. Thank you so much for being a viewer, for being a subscriber. My name is Dr. Chhoda with Ignition Time. Thank you so much. I'm going to give you a detailed update on the President's condition because the President's medical team just did a press conference and they provided a lot of information. The good news is the President is doing well. I'll give you the specifics of what the medical team said because I made some detailed notes as I was listening to the press conference, and I'm going to get started with that update now. So here's where we stand right now. The President has been fever free for the past 24 hours, and at this moment the medical team doesn't exactly know where exactly the President is in the stages of the illness, but the President's team and the President's doctor did say that days 7 through 10 are the most critical to determine the course of the illness. He did say that he was feeling cautiously optimistic right now. Those were the exact words used by the President's physician, so we can take some comfort in that, but he will be monitored closely. So where things stand right now is the President did have a fever on Thursday heading into Friday. Okay, the President has indeed been fever free for the past 24 hours, so that is encouraging. Again, days 7 through 10 are the most critical in determining the course of this illness. On Thursday, the President did have mild cough and fatigue, and he is, as you can expect, being monitored very closely for complications. And when the President's physician was asked several times about whether the President had been on supplemental oxygen, he said that the President has not been on supplemental oxygen today, is not on supplemental oxygen right now. And he said, I quote, all indicators are that he will remain off oxygen moving forward. He was asked to specifically provide a response as to whether the President has been on oxygen in the past, and he said the President has not been on supplemental oxygen yesterday. He did say that also, has not been on supplemental oxygen yesterday, today, and all indicators are that the President will remain off oxygen moving forward. So that is what the President's doctor said. He said the President's heart and kidney function are normal, so that's a good thing. He also said, and this is important, that the President is in exceptionally good spirits. In fact, the President said to the team, I can walk out of here today. So that is what the White House doctor said. And so again, the President is being monitored very closely for complications. The medical team said that, again, they're cautiously optimistic and they're taking a multi-pronged approach. There are many specialists monitoring the President. What the doctor said is that the President is getting plenty of work done through the White House Chief of Staff. He was asked about the President's oxygen saturation levels, which are at 96%. And when he was specifically asked when is the President going to be discharged, the White House doctor said, I do not want to put a hard date on the discharge. So he didn't want to provide a hard date at this point because they're continuously monitoring the President. And again, he did emphasize that it's hard to tell where the President is on the spectrum of this illness because days 7 through 10 are the most critical to determine the course of the illness. So he was specifically asked whether the President was being monitored for blood clots, pneumonia, because these are known risks with COVID, and the response was that the President is being monitored closely. And I want to make clear that the White House physician Sean Conley did say that there is no cause for concern at the moment. So I can tell you that a lot of this information is a big relief, and for all of us. Again, it doesn't matter whether you're red or blue. This is about the red, white, and blue. It shouldn't matter whether you're a Democrat or a Republican. We are Americans first. And this is encouraging news about the President also. And, when the press was given a chance to ask questions, you can imagine that they asked some pretty detailed questions. The doctor was asked if the President, if there was any evidence of lung damage, because COVID does affect the lungs, and the response from the White House doctor was that the President is going through daily ultrasounds. So this is what the doctor said, that daily ultrasounds are being done. And he also said, and I thought this was interesting because there were some reports in the past couple of days that the President had been out of breath, but the White House doctor said the President has never had difficulty breathing. he had cough, he had fever, and he felt a little run down. So these are exact words, and I'm trying to give you exactly what the White House doctor said, without any fillers, without any speculation, because this is too important. This is too important for us to twist, twist one way or another. This is exactly what was said. Also, when the doctor was asked about when the president was diagnosed, he said that Thursday afternoon. He said the president is tested regularly, and he said on Thursday afternoon he had clinical indications, and the testing continued, and then the test came back positive later on in the evening. Now, when the White House doctor was specifically asked how did the president actually contract the virus, when did the president contract the illness, he said, the White House doctor said, I'm not going to get into that. He said, I'm not going to get into that, and he said that is not relevant to the treatment, and he wanted to stay focused on the treatment of the president. Now, he was specifically asked about what are the risk factors associated, specifically for the president, and the White House doctor did indeed point out that the president is 74, he's male, and he's slightly overweight. These are words from the White House doctor. He also said, however, that the president is very healthy. The president, is not on medication for blood pressure. His cholesterol is also normal. And he said that I do believe that the president is on some medication. I believe it's for cholesterol. But what the White House physician said, I just want to be clear, is that the president is very healthy. The president doesn't have any issues with his cholesterol or blood pressure, and he's not on medication for that, which is what the White House doctor said. He said the president is up and active, and he's able to handle whatever he needs to do because he has a very, very busy, a very, very hectic schedule. He also said that the president's heart rate was normal, the president's blood pressure was normal, and he said, I quote, no concerns there, which is a good thing. And when asked about First Lady Melania Trump and why she wasn't hospitalized, the White House doctor basically said that there is no indication for hospitalization for First Lady Melania Trump. So all of this, that is it, everybody. That is exactly what you need to know about the president's condition. Please comment below and let me know if you have any questions. Please share this video with friends and family members, because this way we can get the real information out there, the exact words. I actually paid very, very, very close attention to what the White House doctor said, and then I took an abundant amount of notes in order to be able to give you the exact information in this video. So again, if you have any questions, please type them out in the comment section below. Also, please share this video with friends and family. If you're not a subscriber of our community yet, your vote of confidence in us is you subscribing to the video. Also, please click like. Please enable notifications after you subscribe. This way you get instant updates, and that's your vote of confidence in me and my team and all the work we put in going into, put into these videos. Let me be clear. The president will need to be monitored carefully over the next few days. We should keep the president and his family in our prayers. I've been doing that. I've been doing that ever since we all found out about this. And let's send good wishes, and let's hope and pray that the president and First Lady Melania Trump, recover quickly. It seems like the First Lady is, she's doing better than the president. She didn't need to be hospitalized. So again, let's just keep them in our prayers. And it is important for all of us to note that the president will still need to be monitored for several days, because again, days 7 through 10 are sort of the critical aspects. In fact, let me quote the White House doctor. He said days 7 through 10 are the most critical to determine the course of the illness. So that is the sort of period where things can be touch and go. And and he did say something that was really interesting. He said 72 hours into the diagnosis. That's what he said. And then later he talked about the president's test coming back positive on Thursday evening, which at the time I'm recording this video is less than 48 hours. So it seems like the president is right between, at the time I'm recording this video and at the time I release this video, it seems the president is between somewhere between 2 and 3 days of having this exposure. But let me be clear to my viewers and subscribers, days 7 through 10, which is going to be essentially next weekend, is going to be a period where we have to monitor the president very, very, very carefully. I think it is safe to say that the president will stay at Walter Reed for a few days. And when specifically asked about whether the president would be moved back to the White House, The White House doctor said that if we feel that the president can be monitored closely at the White House, we will move him back. So it's possible the president could be moved back to the White House. Knowing the president, he'll probably want to get back into things as quickly as possible. But I just want to be clear: days 7 through 10, we have to watch and be careful, which is essentially next weekend, considering that right now is day 2 or day 3. That's pretty much it, everybody. Thank you so much for watching once again. My name is Dr. Nitin Chhoda. You're watching the Ignition Time channel. Thank you so much for watching. And again, let's keep the president and his family in our prayers. I know that everybody's sending good wishes. I know that former Vice President Joe Biden also sent good wishes to the president. And by the way, it was revealed that several Republican senators, including Tom Tillis, including Mike Lee, and also this morning Chris Christie from New Jersey. I mean, he's not a senator, but Chris Christie from New Jersey tested positive. So there's a lot going on, and also all the people who tested negative in the past couple of days, and I've mentioned this extensively on my channel: Vice President Mike Pence, former Vice President Joe Biden, also House Speaker Nancy Pelosi, U.S. Treasury Secretary Stephen Mnuchin, White House Chief of Staff Mark Meadows. All of them who've tested negative do need to be tested on a daily basis, because it is not unheard of that somebody is tested negative on one day and then tests positive on another day. That's just the nature of this illness, and that's just a strange reality that we live in. I actually took a test myself several weeks ago because I had felt that my sense of smell was altered, and I actually took my mom for a test. My mom is 75 years old. She lives with us, and she was feeling a little fatigued. So she and I went for the test, and our test results came back negative. So that's where things stand right now, everybody. Thank you so much for watching. I appreciate you. And again, you're watching the Ignition Time channel. Please click like, please subscribe, please enable notifications. I'm looking forward to seeing you in the next episode of Ignition Time. I appreciate you. I'll talk to you soon. Bye.